Yes.
Okay. Start. Okay, hello, my name is Abby. It's 9 a.m. We're gonna give your medication, okay? So I'm gonna be your nurse for right now. Before we start, can I get your name and date of birth?
My name is Ted Lasso. I was born 7/14/61.
Okay, so I'm just gonna double check with your wristband. Thank you. And Mr. Lasso, do you have any allergies?
Latex.
Allergic to latex? Okay, thank you for letting me know. Just before we start, I'm just gonna go ahead and lift your bed up to a comfortable working height for me. Thank you. And I'll just put this side row down since I'm gonna be working on this side. Okay, let's get started. Okay, Mr. Lasso, before I give you medication, I'm just gonna take your vitals. I'm taking Mr. Lasso's vitals, and he was within normal ranges. And Mr. Lasso, are you in any pain?
No.
No pain? Okay, so now that I know this, and I assessed Mr. Lasso's airway, he was talking to me fine. His breathing is unlabored, and he's not having trouble. And circulation, Mr. Lasso, may I assess your capillary refill? And his capillary refill was also within normal ranges, so I know I'm good to proceed with medication administration. Okay, I'd like to just state that I did my 2 checks prior to this. I checked when I received the medication from the Omnicell, and I double checked with my mom that it was the right medication. And now I'll just complete the 7 checks, making sure that it's the right time. It's currently 9 a.m. This is the right route. We're gonna do this through IV piggyback, and then it is the right medication. This is ceftriaxone. This is the right person. I'm here with Mr. Lasso. This is the right amount. We have 1 gram per 50 mLs, and then afterward I'll just provide some education and document. Okay, Mr. Lasso, do you know where you're receiving your medication?
I forgot.
That's okay. So you're receiving your medication since you currently have pneumonia. So the ceftriaxone will help fight the bacterial infection in your lungs. And then before we start, I just want to let you know some side effects, okay? So some side effects of the ceftriaxone could be that you could experience an upset stomach, meaning you might have some diarrhea or vomiting, and it might make you a little bit tired, okay? Is it still okay if we proceed?
Yep.
Yeah. I'm just gonna put on my gloves. Alright, so before I begin, I'm just going to start by cleaning at the IV site. I'll go ahead and dispose of this. Okay, I'm going to clean right here. And then I'll dispose of this. And now I'm going to go ahead and flush at the IV site. And I'll dispose of this. Okay, and now I'm just going to clean at where I will be connecting my medication at the port. And dispose of this. So I'm going to clean right here for 15 to 20 seconds. Okay, and I'll go ahead and put it right here while I spike my bag. So for demonstration purposes, my bag is already spiked, but if not, I would just simply insert it. And I'm making sure that all my medication is in the bag. And this is brand new tubing, so we know that it's already clean. But I'll start by inserting it right here at this freshly cleaned port.
So I have this on now, and I have my
Okay, at this point I will unclamp.
take it out.
I would unclamp and ensure that I'm back priming to clean out the tubing. And I can see the water flowing, and I'll just wait until it fills into that halfway point. Okay. So I just back prime, so now I'm gonna hang my bag.
And I'm going to take off these gloves now. And while I'm putting my sterile
And I was already running a normal saline drip, so I'm gonna move to also adding my second medication. So, and then I'll just pick the ceftriaxone. And I know I'm running 1,000 milligrams per 50 ml. Yes. Okay. So I'm just gonna double check with my MAR that this is 50 ml and 1,000 milligrams. Looks correct. And then I'll just move to next. And I know that this is one more time 50, 100 milliliters, and it's running for 30 minutes. So this is the correct dose. So I know that I'm good to start.
And I want to make sure that during this time I do remain sterile and I do not leave my hands on the waist level.
Okay, and I'll just wait to ensure that it is bubbling up.
And I'm going to make sure that I do put it showing you that I'm down. Because I want to record it.
It's still.
And I'm going to place it.
And I've already connected it to the IV site, and everything is unclamped. So we're just waiting for the machine to get started. While I'm waiting for my IV to start delivering the medication, I'll go ahead and label my IV bag with my initials, date, and time. Okay, I just saw my first drip, so I know the infusion's running, so I'll go ahead and perform hand hygiene before I leave Mr. Lasso's room. I dispose of the gloves in the trash. Okay, Mr. Lasso, your medication is going to be running for about 30 minutes, and then it'll go back to the normal saline drip, okay? So I'll go ahead and lift your side rail. I'm going to lower your bed back to the lowest position. Okay, is there anything else I could do for you before I leave?
Nothing.
Thanks. Okay, so I'll be back to check on you in a little bit, all right? Now that I've given Mr. Lasso's medicine, I'm going to document on my MAR. So I know that I administered the medication at 1-900/do it and my initials. Okay. It's been 30 minutes and I'm back to reassess my patient to see that the medication was delivering properly. So I'll put on my gloves.
Well, not the cafeteria, the kitchen, and the surgical place.
Oh, just that little snap.
Yeah.
Hello, Mr. Lasso. It's been 30 minutes since we've given you your medication, so I'm just back to make sure that everything's going smoothly. I'm going to start by assessing your IV site.
I didn't check it.
Okay, so I don't see any redness or erythema, and I see that the medication is still delivering smoothly. At this point, I'll just go ahead and reassess Mr. Lasso's vitals and recheck his ABCs to make sure everything is in order and running. Mr. Lasso's vital signs and ABCs were within normal ranges, so I'll be back to check on him again in about another 30 minutes. Come in. Hello, my name is Abby. I'm going to be your nurse today. I'm going to be inserting your Foley catheter as ordered by Dr. Yang. So I'll go ahead and perform hand hygiene. And can I get your name and date of birth?
Yes, Rose Valentine, November 1st, 2000.
Okay, thank you. Miss Valentine, I just want to let you know that you will be uncovered for a long amount of time, so it might be a little bit uncomfortable for you. Is that okay?
Yes, that's all right.
Okay, then we'll go ahead and get started.
Okay.
Oh, just before we start, I want to ask, do you have any allergies?
No.
No allergies? Okay, perfect. Valentine, we're now gonna be performing your pericare just so you're all cleaned up for when we insert the Foley, the urinary catheter. So I'll go ahead and start by lifting your bed to a comfortable position for me. So just want it to be at waist level so I'm not bending down too much. Perfect, and I'm gonna go ahead and put this side rail down. I'm gonna be working in this area. I'll go ahead and give my hands clean one more time. Alright, and I'm gonna go ahead, I'm gonna uncover you. You're gonna be a little bit cold just while I'm cleaning, so let me know if you're uncomfortable. At any point we can stop, take a little break. Okay. Alright. I'm gonna go ahead and put on my gloves.
And now we're gonna take the gloves off.
Okay. So now that my basin is filled with water, I'll get a soapy towel. Gather that in. And I'll set a towel to rinse. Okay. So I'm just gonna go ahead and go to the side. I'm gonna be touching you now. Is that okay?
Yes.
Okay. Side. Flip. With my soapy towel to the other side. Flip. And then down the middle. Okay. How are we doing? Feeling okay?
Yeah.
Okay, so I'll go ahead and dispose of that towel. And I'll take my rinse towel. I'll go ahead and rinse this side. And then the other side. And then down the middle.
Wait, does this one not work?
Okay. Now I'll go ahead and dispose of this one. And then finally I'll take my dry towel. Go down this side. Same side. I know it's a little rough, but this side. And then down the middle.
Step past me the trash, please.
Okay. Go ahead and take off my gloves.
I'm not gonna.
Did this. One hand I do one more time. Okay, it looks like we're about ready to get started with the Foley catheter insertion. So we'll move on to that next. Okay, I just cleaned up my materials for pericare and I washed my hands with soap and water. So I'm gonna go ahead and start the urinary catheter insertion. Miss Valentine, I'm gonna go ahead and position your legs in froggy style. I'll assist you. So we're just doing this position so it's easier for me to insert the catheter. Please do your best to keep your legs in this position. I know it's very uncomfortable, but we're going to try not to move our legs as to not touch any of my equipment because that could be cause for contamination, lead to infection. So let's just do our best to keep them like this, okay? Okay. So I'm going to begin by opening up the packaging. I'll leave this here and I'm going to roll this into the bag to collect my trash. Alrighty, I'm gonna place this to your side, okay? Okay, and now I'm gonna open this up, making sure to only touch that outer 1-inch border. Okay, and I'm gonna go ahead and touch my gloves, and I can touch them since they haven't been cleaned yet. And I'm gonna open this up, making sure to only touch the outer 1-inch border. Making sure to maintain sterile technique. I like to point out that in the real world, the sterile gloves will not be poking out of the packaging. So I'm going to start with my dominant hand by touching only the inside.
Hi guys.
Just slipping my hand into place. Alrighty, and now I'm gonna scoop under to grab that second glove. And I'm gonna slip my non-dominant hand in. The outside, and now that my gloves are on, I can fix my hands. Inside and from the inside. Okay, now that my hands are sterile, I can touch everything inside my sterile field. So I'm gonna start with my pad and making sure to place it shiny side going down. Okay, I'm gonna tuck this right under you. Okay, and now I'm gonna set up my field with my sterile gloves. I'll go ahead and put this here. I'll move my tray into place. And I'll set up my station. So I'm gonna grab this. I'm gonna grab all of my swabs, place them right here for me, and I'm gonna go around ensuring that I don't touch the field. And then I'm gonna set up my lubricating gel. Just take it off, squirt. And then I'm gonna go around, making sure not to drop my hands. Alrighty. Now I'm going to move ahead with practicing my balloon pump. So I can touch everything that is sterile. And I'm gonna remove this carefully, making sure to avoid any swinging. As I remove this, I'll go ahead and wrap it around my hand. And I'll dispose of this. Okay, at this point, I'll go ahead and put it in the gel, in the lubricating gel. I'll roll it around, ensuring that it gets properly lubricated. Okay, at this point, I'll go ahead and ensure that the balloon pumps properly. So I'll take my syringe, dispose of the cap, and place it in the port. Okay, I'm gonna insert 5 ml of water, making sure that it inflates properly. Okay, after inserting 5 ml, I see that the balloon is inflating, so I'll go ahead and deflate it at the moment. I'll leave this here in place for me. Okay, ma'am, I'm going to touch you now. I'm going to be cleaning your urinary meatus with the swabs. At this point, I like to establish that this will be my clean hand for touching the patient, and this will be my sterile hand that I will maintain sterile technique with. Okay, I'm going to touch you. Is that okay?
Yes.
Alrighty, so I'm going to go ahead and grab the patient right here. Okay, I'm going to begin by swiping to the right, and then going around and disposing, and then to the left, and disposing, and then into the middle, ensuring that I see the wink. Okay, ma'am. At this point, I'm going to commit and insert the urinary catheter. Ma'am, you may feel a little bit of resistance, so you let me know if you're in any pain and I can stop.
Okay.
Okay, I'm going to grab my catheter and begin insertion. Okay, I'm going to go 1 to 2 inches at first. And I did just see urine flashback, so I'm going to push another 1 to 2 inches until I feel resistance. At this point, I felt resistance, so I'll go ahead and secure with my other hand and grab. I'm going to insert 5 milliliters. Okay, I inserted 5 milliliters, and I'll go ahead and remove. Both of these hands are now non-sterile, and I'll go ahead and dispose of this. I'm gonna give the catheter a tug to make sure that it's in place, and I'll place it immediately on the stat lock, locking it in place. At this point, I'll go ahead and clean up my area. So I'll clean up my whole area and remove my gloves. So I would clean my area before, but for video purposes, I'm gonna go ahead and grab my bag. This is again with clean hands. I'm going to take my pen and label the bag, ensuring that I have my name and date of insertion, and I will place it on a movable part of the bed so that there isn't any risk for pulling the catheter out. And now would be a good time to take a urine sample from the bag, as the urine is fresh. Okay, hello Miss Valentine. It's been 3 days and I have doctor's orders to take your urinary catheter out. Is that okay with you?
Yes.
Yes? Okay. So at this point, I'm gonna perform hand hygiene and place on clean gloves, since I'm following clean technique for removing her urinary catheter. Alright, ma'am, I'm gonna uncover you. Is that alright?
Yes.
Okay, I'm gonna place this right under you to catch any leakage. And then I'm just going to, this would be connected to the stat lock, but I would just go ahead and take my syringe and insert it at this place. And I'm going to begin by deflating the balloon of all the water, because it would be painful to remove with the balloon still inflated. Okay, So I'll go ahead and get rid of this. I'll dispose of this in the trash. And now I'm going to take my hand and I'm gonna remove this gently, catching any urine. Okay. And now I would dispose of the urinary catheter in the garbage. I just completed catheter removal, so I'll dispose of my soiled gloves. And I'll perform hand hygiene once more before touching the patient. Okay, ma'am, I'll go ahead and lower your gown so that you're more comfortable and not exposed. Okay, and now I'll move your bed to the lowest position. Is there anything else I could do for you while I'm here?
No.
Do you want me to move the head of your bed up at all?
No, I'm okay. Thank you.
Okay. So the patient is at the lowest position, but I'll just go ahead and put all their side rails up, ensuring that I do it on all 4 sides, so if they roll over, they don't fall. Okay, and now I'll just place your call light within reach. And if you need anything, let me know. I'll be back to check on you in about 30 minutes.
Thank you.